So Hugh, would you like to explain to everyone what is risk stratification?
So risk stratification is born of the concept of frailty, which is a holistic idea about somebody's ability to withstand knocks and being unwell, physical and social and financial different attributes would contribute towards this idea. And so if you can measure within a population group different levels of risk of becoming unwell as a result of that, then you may well be able to step in and do something to prevent an individual deteriorating by catching them at an earlier stage. And the whole idea of this risk stratification is to try to get groups of people for whom we could make that intervention and prevent them getting more unwell.
So Angus, would you like to explain why we're undertaking risk stratification in West Essex and what does it mean for our patients in general practice?
Hugh's mentioned the concept of prevention, and I think we're all aware of the increasing pressures and workload of our increasingly older population and the effect that's having on our GP's practices and the knock-on effect it has on patients. This is a real opportunity to look at the people who we know in the next few years are going to become increasingly unwell, to say, well, what can we do now to stop them becoming so unwell in the future? And that'll help their own health, it'll help our future workload and our quality of life for our patients and healthcare professionals in West Essex.
So Danny and Debbie, through doing this work, what are we going to do differently?
So I guess at a practice level, population health management is something that we have consistently been aware of, but perhaps by using the model of risk stratification, it's an opportunity to think about what's on offer for our patients at each of those different risk levels. So what are we going to do for our patients differently who are those that don't come and see us very often, so the self-care group, progressing up to those that are quite high risk of either admissions or multiple visits to the surgery or need quite a lot of acute intervention. So it's an opportunity to think about how do we manage the patients in the practice. As Angus said, there is ever reducing time to manage patients, there's an increase in the acuity of patients, and then that means an increase in the amount of time that we need to spend. So thinking about my time is precious in a patient's perspective or in a healthcare professional's perspective, what we do in that time is really important. So I think risk stratification at the moment is the first step, actually identifying the patients that are in each of those categories, but then thinking about, okay, now that we know who they are, how do we do something differently for them in the practice? How do we join up our teams? How do we join up those teams with our community teams and our hospital teams as well, so that we can just work more efficiently?
And following on to that, it's really about the care coordination. So how are we going to use our resources around the neighbourhood in the most efficient manner? That's from social care, mental health, community, and primary and secondary care. So really thinking differently, and also how we can start getting the patients to help that by self-managing their own care as well. So it's really an opportunity to really think differently and structure ourselves in a different approach.